Getting the COVID-19 booster is about doing our part to love and protect our families. Vaccines are a life-saving tool in the fight against the virus. Over time, they become less effective at preventing serious illness, just like other vaccines. We need the boosters to increase protection against COVID-19 and its variants, ultimately preventing us from getting really sick or dying. So do it for your family, especially those at higher risk. Protect the ones you love. Vaccinate.
Hello, everyone. Welcome to today's Inquirer Live Report, sponsored by Independence Blue Cross. I'm Letitia Stein, Health and Science Editor for the Inquirer. Today, I'm talking with Aubrey Whelan, an Inquirer health writer who covers addiction and specifically has covered the opioid crisis in the Philadelphia area for nearly 5 years for the Philadelphia Inquirer. Aubrey, thank you for joining us today.
Thank you for having me.
To set the stage, overdoses are killing Philadelphians at a pace that is more than twice the murder rate, and this crisis is expected to keep growing, with the local drug supply increasingly flooded with dangerous additives such as fentanyl, a powerful synthetic opioid driving an explosion of deaths, and Xylazine, an animal tranquilizer that increasingly is showing up in drugs in the area. Aubrey, can you share with us how you've seen this crisis evolve over the last couple of years?
Sure. So I started covering addiction and the overdose crisis in 2018. And that was right after the worst year on record at that time for overdoses in Philadelphia. 1,217 people died in 2017. It was a more than 300, somewhere around 300 death increase from the year before. It was really scary and just really kind of called out for attention. And a lot of my colleagues had been, writing a lot of stories and bringing a lot of really necessary and needed attention to the crisis at that point. Mike Newell, my colleague, who's on the features desk now, wrote a series of columns about Kensington and the overdose crisis there. And it was just, it was awful then, and it's gotten worse. I think that one of the more frightening and more serious things that the crisis has kind of evolved with is the rise of fentanyl. It's present in most of the fatal overdoses that Philly sees. It's turning up in other drugs that are not opioids now, and that's been one of the really upsetting and alarming developments in the crisis, is that we're seeing people who are not used to taking opioids dying of overdoses with stimulants in their system, for example. I think one of the biggest developments in the last few years has been the increasing contamination of the drug supply, and that's made it really difficult to get overdoses down, and it's also kind of made health officials here realize that this is not just an opioid crisis. This is a crisis that's, that affects all drug users and recreational drug users as well, not just people who are addicted. So,
and just to put Philadelphia into some context, Philadelphia is often called the epicenter of the nation. This.
I'm sorry, I think you froze a bit there, but
what do we know about how the pandemic has further affected the long-term trends in Philadelphia, which of course is a national epicenter for this crisis?
Right. Well, I think the pandemic worsened trends that we were already beginning to see here. We saw a big spike in deaths around the first few months of the pandemic, and that's probably due to the isolation, the stress, and also people, like I said, the isolation. People were alone, and using drugs alone is one of the most dangerous things that you can do in the middle of an overdose crisis. I also think that you can see trends that were starting to emerge before the pandemic, just kind of getting heightened during the pandemic and after the pandemic. For example, Black Philadelphians are dying at a much higher rate now. And that was a trend that was starting to emerge before the pandemic and got worse in the last couple of years. And that still holds true in the most recent data that we have for 2021. And it's a really, it's a reminder that, this is a crisis that's been stereotyped as something that affects white people. It never has been, but it's becoming, more of a problem in the Black community for people of color. And I think it just, is a sign that we really need to do outreach to communities that haven't gotten the kind of outreach, attention, harm reduction resources that other communities have gotten over the course of this crisis.
Do we know, is the crisis the same, or are there any significant differences between Philadelphia and the suburbs?
It's certainly less pronounced in the suburbs. It's certainly less visible. It doesn't mean it's not there. It doesn't mean that people don't overdose once they're across the Philadelphia border. Certainly Philadelphia bears an outsized burden, but there's a great need for resources and attention in the suburbs as well, particularly harm reduction resources. Philly has syringe exchanges. Philly has, maybe a little bit of a more robust harm reduction apparatus than some of the suburban counties do. And it would be great to see some of that out there.
Yeah. Thank you. I wanted to thank the audience for sharing some questions with us. And if anybody has questions for me or for Aubrey, please submit them at the bottom of the watch page in the comment section. If you're watching from social media, please go to inquirer.com/live to submit your questions. Aubrey, you recently wrote about a drug called Xylazine, which is an animal tranquilizer, which is now showing up in the regional drug supply. Can you please tell us a little bit more about what this does and why it is being used as a drug? And do people even have any ability to know that?
So Xylazine is, as you said, is an animal tranquilizer. It's not intended for human consumption, but it started turning up in opioids, fentanyl. A couple of years ago was when I first started hearing people talk about it. It's the slang for it is trank. And the perception is that it gives fentanyl like legs. So fentanyl has a short half-life. If you're compared to when you're using heroin, like a dose of heroin, if you're dependent on it, might get you through several hours, a day without experiencing symptoms of withdrawal, which when you're addicted is kind of like, you're not using anymore for a pleasurable high. You're using because you're going to experience extreme pain if you don't use. So heroin would get you through maybe like a day or, several hours, depending on how high your tolerance level was. But fentanyl has a shorter half-life. So for people who made the switch from heroin to fentanyl, usually because they didn't have any choice, fentanyl has kind of replaced most of the heroin in Philly. A lot of drug users started to realize that they were entering withdrawal faster when they used fentanyl. So Xylazine is perceived as being added to the drugs by distributors because it's perceived, or the theory is that like it's perceived as giving fentanyl legs, that like if you take Xylazine with fentanyl, you'll have a longer lasting high. But Xylazine comes with a host of other problems of its own. It also affects breathing. So it can make overdoses more difficult to reverse. Some people are reporting that it's causing lesions on their skin that are really hard to treat. And it's also, there's just not a lot we know about it. And that makes it really dangerous just to have in the mix because it's newish and because, it causes these symptoms that are really alarming for people. And, again, it's another aspect of a drug supply that's really contaminated, which is kind of new as well. Philly used to be known for very pure heroin. And now it's, you're going to get trank in your fentanyl probably, or you're going to when you're buying drugs, you have to, there's this expectation that there's going to be some sort of contamination in what you're buying.
Yeah. And with both fentanyl and xylazine, do people necessarily know if they are taking these drugs? Is there a way to do so?
So fentanyl, initially, and this was one of the really scary aspects of, the crisis a few years ago, was that, fentanyl was turning up in the heroin supply among people who were primarily used to, again, very pure heroin. And it's so strong that it was killing people who didn't realize that it was in there. Now we're at a point where most people expect to find fentanyl in their heroin, or expect to buy just fentanyl and not heroin. A lot of people have developed tolerance to it, but it's still, it's, again, as I mentioned, the problems with like the withdrawal, the quick withdrawal, like the early withdrawal, make it really difficult to just kind of be, you're constantly looking for something that's going to take the pain of withdrawal away. But with fentanyl, you can at least test for it. There are fentanyl testing strips that you can obtain through a number of different sources here in Philly or online. I think we'll have a link to that later in the program. So you can test for the presence of fentanyl in your drugs. And that's super useful for, especially for people who aren't used to taking opioids, for people who are purchasing, say, cocaine. And, we've had people in Philadelphia die with stimulants and fentanyl in their system, stimulants like cocaine and fentanyl, methamphetamine and fentanyl. And no one's quite sure exactly what the what's driving that rise in stimulant fentanyl overdoses, but some of it is likely people who thought they were taking stimulants, didn't realize that there was fentanyl in it, and were not tolerant to opioids, so overdosed and died. So if you are taking cocaine or methamphetamine or another drug that you don't think could have fentanyl in it, it's always really good to test to be sure, because there is the possibility now that there could be. Xylazine is a little bit different. I don't believe that there's a way to street test for Xylazine in the same way that we have testing strips for fentanyl. So yeah, people might not know that they're getting Xylazine, or they might not. They might feel strange effects from a drug that they thought was, fentanyl, or something that they expected was, going to make them feel one way and is making them feel a different way. So that's something to watch out for as well.
Thank you for that. I'd like to ask you about something else that you've written about recently. You have recently written a story about problems at Prevention Point, which is one of the best known players in Philadelphia in the fight against opioids. This is a nonprofit. It has long run a syringe program where people can trade in used syringes for sterile ones to reduce some of the health problems that can be associated with drug use. Can you just share with us a little bit about what your reporting found in terms of what has been going on at Prevention Point, and are there any indications that it's impacting their ability to help people?
Sure. I think one of the one of the main things to point out about this story from the get-go is that syringe exchanges are a legitimate public health intervention, and there's decades of evidence that show the good work they do. Unfortunately, the syringe exchange in Philadelphia, several months ago, a number of former employees there approached the Inquirer to talk about working conditions there. They talked about safety issues, issues with like the physical plant of the building, sewage, flooding issues, and also some serious allegations of sexual harassment that they felt were not handled well by upper management there. And it was a really difficult story to report. And a lot of the people that I spoke to, most of the people that we spoke to for the story, the former employees, stressed how much they cared about the mission at Prevention Point, and how necessary they find the syringe exchanges, the need for a harm reduction organization, because it's more than a syringe exchange, of course, it's a public health organization. There's a lot of, really necessary health interventions that people in addiction need and often can't access. From the workers' point of view, has absolutely impacted their ability to deliver services to clients, whether from, just the stress of working in an environment where they were, either sexually harassed themselves or witnessing the sexual harassment of clients and colleagues. The building issues that made it hard to, treat people in a clean space. Certainly they felt that their ability to help their clients was jeopardized. Prevention Point for the record, has denied many of these allegations and has said that first acknowledged some of them, but said that they've fixed the issue. So.
Thank you. Beyond Prevention Point and even, beyond perhaps the Philadelphia area, do you see anyone or, anything making some changes or some innovations that you're sort of sitting up and noticing in response to how it's dealing with this crisis?
Yeah, I've been really interested in following the development of the supervised injection site that's opened in New York. It's the first in the country. It's longtime readers of the Inquirer might know Philadelphia has its own very long history, not very long, but for us, years long history of trying to get a safe injection site opened. Hasn't happened yet. So New York opened one last November, and they've saved, I think I looked at least 100 lives, people overdosing inside their facility. So I'm very curious to see how that operates. Obviously, supervised injection sites operate in about 30 other countries. Some of them have been going for decades. So I'm really curious to see not only, how the site is, working from a harm reduction perspective in New York, but also how it's working from a community perspective, how the people who live around it feel, and how it kind of integrates with, the surrounding community, because that's in Philadelphia has always been a really big concern as well about, how a safe injection site might work wherever it's planted. So what else am I interested in? Rhode Island has been doing really interesting stuff as well. They also legalized supervised injection sites last year. They have not opened one yet, to my knowledge. But they've also been doing like really interesting things in their prison system by just vastly expanding the kind of medication-assisted treatment that people in jail can access. And I know for the year that they started it, it was that program, the medication-assisted treatment program in the prisons, was credited with lowering overdoses statewide. Access to treatment in prison, because so many people with addiction are arrested and do end up in prison, unfortunately. Access to treatment in prison is crucial, and in Pennsylvania, we really don't have an adequate statewide, treatment system that can help people, especially people in jail, people who are serving short sentences. That can really vary from county to county. And Oregon decriminalized all drugs about 2 years ago, which is fascinating. And I don't know too much about what's been going on in Oregon, but I did visit Portugal in 2020, right before the pandemic. Portugal has decriminalized all drugs since 2000. So it's a 20-year thing they've got going there. And overdoses in Portugal plummeted. Portugal's fascinating because Portugal also had a similar addiction crisis to the United States in the 80s and 90s. There's just explosion of heroin addiction and overdoses. And they decriminalized drugs in 2000, and overdoses dropped. And the way that they speak about drug education, about prevention, about what happens to people who actually are caught using drugs, and the kind of services that they get, instead of getting arrested, is really interesting. And again, I'm very interested to see how that kind of model works here in America. So.
And at this point in time, in our area, are lawmakers promoting any plans, or is there anything advancing on the policy front that could be getting some attention and traction?
Yes. In Pennsylvania, there is a push to legalize fentanyl testing strips, which is super encouraging. It's a bipartisan effort. Like I mentioned earlier, fentanyl testing strips are really crucial in this kind of phase of the crisis, because the drug supply is so contaminated. If you know that your drugs contain fentanyl, you can either choose not to use them, You could use less, or you could make sure that someone watches you while you use them. It's just a really good and easy and accessible way of, helping people just kind of, make good decisions about the drugs, or make more informed decisions about the kind of drugs that they're using. So that's really cool. There's also a push to legalize syringe exchanges in Pennsylvania that is a bit more controversial, but there are lawmakers who are advocating for it. Pennsylvania is unusual in that, we do have syringe exchanges operating across the state, but they're operating kind of at the behest of their own cities, or operating in some cases underground, because they're technically illegal here. And we're one of very few states where they're explicitly illegal. And there's been a long push by advocates to legalize syringe exchanges, just because, besides, just opening up harm reduction resources to, more people around the state, it also is, if you look across the river in New Jersey, syringe exchanges are regulated and overseen by the Department of Health. They're opening them there's a new law or a new directive in New Jersey that kind of puts the responsibility on opening and, maintaining syringe exchanges under the Department of Health, which means that, it's not up to a single city or county anymore whether or not they can open a syringe exchange or whether they can block a syringe exchange from opening. The Department of Health can just say, we're going to open a syringe exchange here. So that's extremely interesting. And I would like to see, kind of the debate on that as it moves forward in Pennsylvania.
Yeah, certainly the solutions are, it seems like, possibly as varied and complicated as the problem itself. We're getting some fantastic questions from those who have joined us today. Thank you. Maybe I'll start with one, which is a solutions-oriented question, which is namely, can you share some of the ways that people could volunteer or contribute, or what are some of the organizations that might be able to be of assistance in dealing with this crisis? And this would be also perhaps an emphasis on some of the harm reduction organizations, and perhaps you can also explain a little bit about what that philosophy means.
Sure. So harm reduction is a concept that basically is focusing on the idea that people are going to use drugs, and many people are going to enter recovery. Some might not be ready to enter recovery. Some might never stop using drugs. And the idea is that you can make drug use as less harmful through a number of different interventions. There's a tenet of harm reduction that says you can't recover if you're dead. And so things like syringe exchanges, which prevent the spread of bloodborne diseases, Narcan distribution is an example of harm reduction, the overdose reversal drug. Fentanyl testing strips are another example of harm reduction. And there's a lot of different harm reduction principles surrounding specific drugs, how you can use more safely, how you can, one of the things that I heard in Portugal from a drug testing service that basically looked at testing drugs for, like party drugs, basically like ecstasy, for like sort of the club scene. Their tenet was kind of like, harm reduction is about reducing harm, but also maximizing pleasures. Like that might be, an incentive for some people to do safer drug use. So yeah, all sorts of, concepts that are basically just boils down to not dying when you're using drugs, because no one deserves to die. So in terms of volunteer opportunities in Philly, there's a ton of organizations that do work in Kensington that accept volunteers. I also think that, there's kind of a lack of outreach in other neighborhoods outside of Kensington. So I'm not coming up with any like particular organizations, but I do think that neighborhoods like West Philly, South Philly, North Philly, really need help and outreach and education in terms of harm reduction and overdose prevention, and are not getting it, or at least are not getting the kind of attention that Kensington has gotten over the years. So anyone that can kind of volunteer their time out there, I'm sure would be very welcome. And I've written a bunch of stories about like different organizations that are, doing that kind of work in some of those communities that have been underserved. So I can maybe try to link to that later or tweet it out at the end.
Thank you. And I know we have some general resources too that we can share at the end. Yes. May I ask very quickly too, you've mentioned Kensington. Can you just elaborate a little bit on why there has been special attention to that community?
Yeah, Kensington has a very visible open-air drug market and very visible open-air drug use. And it's a neighborhood that is, has been neglected by the city, suffered disinvestment. A lot of people who live there feel that, drug use has been kind of concentrated in the neighborhood, and that, Kensington has been sort of designated by others in the city as, the place for drug use, which is really unfortunate. It's a great neighborhood. It's full of wonderful people, from the volunteers and advocates who are, actively working to help people in addiction, who are, oftentimes community members themselves, to the people who are just trying to get by up there. It's a neighborhood that's in need of real help. And, it's also a neighborhood that, as community members have told me time and time again, like deserves to, have that help and have that intervention directed by and led by the community itself. So yeah, Kensington is, it's kind of it gets brought up a lot in these conversations because the crisis is so visible there. But it's also, there's a statistic that the city brings out when they talk about overdose deaths at the end of every year, and something like 75% of overdose deaths happen in homes. So while the crisis is very visible on the streets of Kensington, it's not confined to the streets of Kensington. Like, it's very easy to see photos from Kensington and think, okay, well, drug use happens there and nowhere else in Philly. And that's not true at all. And, I live in South Philly. It's certainly down here. It's just happening in people's basements and bedrooms. And, that doesn't make it less important, and it doesn't make it less crucial that we reach those people. So, I'm really passionate about kind of talking about this as a citywide crisis and not one that is confined to a single neighborhood, because it never has been, and it's certainly not now.
We've received another very interesting question that I'd like to share with you concerning, overcoming withdrawal. And the point is that this seems to be, a key issue, right? How do you overcome the difficulty of withdrawal? Can you speak a little bit to some of the interventions that are taking place? Maybe, is there a standard of practice or of care? And then is there anything more innovative that's being tried as well?
Yeah, the Xylazine withdrawal problem is, and I don't know if I touched on this earlier when we were talking about Xylazine, but like the other thing with Xylazine is that it also creates these like really intense withdrawal symptoms that makes it really hard for people to wait to get into treatment. And that's another problem with the system in general. It's often, you to enter treatment, you have to see, you have to be assessed at a crisis center or by a doctor, and that can take hours. And, when you're in active withdrawal, you're nauseous, you're, shaking, you feel all this pain. It's like, you don't have hours to wait. It's really difficult for somebody in withdrawal to kind of just hunker down and, wait it out until they can get into treatment. And sometimes the waits are, 12 hours. So yeah, withdrawal management is like super important. And I'm looking at the question itself. And they mentioned that there's something going on at Jefferson where people are trying to overcome withdrawal using a combination of buprenorphine and ketamine. I have not heard of that, but that is extremely interesting, and I would like to look into that. Yeah, but I mean, there's definitely things that have been done in Philly to kind of ease that, period where you're waiting. There's a 24-hour intake center up at 5th and Spring Garden that essentially is designed to, like, when people come in, they'll they ask for treatment, and then they will give you like comfort medications to kind of help you through that withdrawal period. I know that emergency rooms have are trying to treat people with buprenorphine or get folks. I know at Penn there's been a big push to certify doctors to prescribe buprenorphine in the ER so that they can help. Buprenorphine, sorry, I should say, is an opioid-based drug that is used in medication-assisted treatment for opioid use disorder. But in the Penn ERs, they've been pushing for a long time to certify doctors to be able to prescribe buprenorphine to people in the emergency room so they can kind of deal with withdrawal symptoms easier. And that's the other thing. There's a whole other thing with the restriction and prescription of medication-assisted treatment for opioid use disorder that is also another huge barrier to access. I think that withdrawal management it comes down to getting people the right drugs in the right time frame, and sometimes it's just we're not hitting the marks that we should.
I know our time here is close to the end, but maybe just a little bit more on that point. I believe you've written recently that we did see during the pandemic some ability to do things in terms of offering withdrawal treatment that had not been permitted previous to the pandemic, and we learned some lessons from that. Could you tell us a little bit more about that, please?
Yeah, so during the pandemic, in an effort to, I guess I should talk about the landscape of medication-assisted treatment for opioid use disorder. So there's a couple of options for medications when you have an opioid use disorder. If you decide medication is the path for you, there's methadone, which most people have heard of. It's an opioid agonist, which means it's an opioid itself. It's a drug with a much longer half-life than fentanyl, than heroin. It allows people to basically go about their day without experiencing cravings or withdrawal. It's been kind of a standard treatment for decades, but it's heavily federally regulated. You have to go every single day, for the most part, to a clinic at the same time to pick up your single dose, and then you have to just keep going back. It can be really frustrating for people who are kind of trying to get back on their feet after an addiction, people who just want to go back to having a normal life. It sort of interferes with people, going on vacations, seeing their family, holding down a job. Then there's buprenorphine, which can be taken at home, but there are still significant restrictions around its prescription. Only certain doctors can prescribe it. You still have to be kind of under supervision as you take it when you're first taking it. And it's, especially for people with a super high opioid tolerance, it might not be as effective as methadone. During the pandemic, one of the restrictions on buprenorphine was that you had to be in front of a doctor. Like, you'd personally see a doctor to get it prescribed. So during the pandemic, the federal government lifted some of the restrictions around methadone and buprenorphine. People could take methadone home for up to a month, which was previously a very rare privilege that people would get after they'd been, kind of consistently going to a clinic for years. So that was a really big development for, people in addiction who were on methadone. And there was a study released by the National Institute on Drug Abuse that found that move did not increase overdoses at all during the period that it was enacted, which was really good news for kind of loosening that restriction. Buprenorphine has also been it's easier to prescribe now. It can be prescribed over telehealth, so you don't have to go physically in person to a doctor's office to see it. So it's an encouraging development, and I know that there are legislators and folks in health policy and federal health policy who are would really like to see these changes made permanent. So.
Thank you, Aubrey, for all of this insight and perspective. And thank you all for joining us for the Inquirer's Health Report, sponsored by Independence Blue Cross. We hope to see you next time. To read more about Aubrey's coverage of addiction and health disparities, please visit inquirer.com/health. And if you or someone you know is struggling with addiction, please reference one of the resources found on the watch page at inquirer.com/live, or the ones that we will now show on the screen.